Cystitis is inflammation of the bladder. So you'll see frequent urination, suprapubic pain, and dysuria. So it hurts to pee. And hemorrhagic cystitis during therapy with cyclophosphamide is caused by the excretion of a toxic metabolite, which is called acrolein. Okay, so how are we going to prevent this? How are we going to prevent our patients from getting bladder irritation, bladder cancer? Well, we're going to give them Mesna. Okay, so this patient's taking cyclophosphamide, and the toxic metabolite is acrolein. And so the clinical cues would be your dysuria, the suprapubic tenderness in the bladder area. So you give them Mesna. That's the answer. 65-year-old chemotherapy for non-Hodgkin's lymphoma. Let's say they're on cyclophosphamide. Which medication is going to prevent these adverse effects? Mesna. All right. Dexrazoxane. That's going to be preventing your cardiotoxicity. So for doxorubicin, you can give them the dexrazoxane. Filgrastim. That's going to be used for the neutropenia. So what we should know about that one is it's a granulocyte colony stimulating factor. It's not going to be relevant for anything associated with the bladder at all. And leucovorin, that's going to be a rescue from methotrexate toxicity. And they might also ask you about like fulonic acid, like that's leucovorin, and it's just going to be a rescue from methotrexate. And then ondansetron could be another option. That's not going to be correct. That's an antiemetic. That's going to not be associated with bladder stuff. That's going to be nausea and vomiting. So if they were to ask you about ondansetron, that would not be the right answer as well. So yeah, think about Mesna whenever you're dealing with these toxic metabolites that can cause bladder problems, like if you're taking cyclophosphamide. Okay, see you in the next vid.